Okay, you're now live.
Thank you. Council was pleased to, item number 1, notification of the appointment of the Chair and Vice Chair of Adults Committee. Council was pleased to appoint Councillor Anna Bailey as Chairwoman of the Committee and Councillor David Ambrose-Smith as Vice Chairman for 2020-21 when it met on the 19th of May 2020.
Thank you very much indeed, Tamar, and welcome everybody. I'd like to just start by welcoming those members of the public and press who may be watching the live stream of this meeting via the website. Due to the government guidance on social distancing, this meeting is being held remotely in accordance with the provisions set out in the relevant Act and with Cambridgeshire County Council's own virtual meeting protocol, and a decision, summary and minutes of the meeting will be produced in the usual way, and as you know, a recording of the meeting will be available to view on the meeting page of the Council's website after the meeting. To enable the meeting to run in an orderly manner, I would ask all members of the committee to keep their video cameras switched on for the duration of the meeting and to keep your microphones muted except when invited to speak. Officers will join us as necessary to introduce their reports in the usual way. And any member wishing to ask questions or make a comment, if you can, we're getting used to this now, but if you can indicate your wish to do so by using the raised hand function on the right hand side of your screen. And when I invite you to speak, please unmute your microphone, ask your question and then mute it again so that we can make a response. And as you know, at the moment, there's no points of order or personal explanation. And obviously, if anything goes wrong during this process, we may need to halt the meeting, but hopefully it'll all go smoothly. And as usual, please note that to facilitate discussion, I'm waiving the committee procedure rules, which limits members' contributions to 5 minutes, and proposed as ever to allow members to speak more than once on each item if appropriate to allow proper debate. So please try and keep your contributions concise and to the point. And I'd just like to start by welcoming Councillor David Ambrose-Smith as a new member of the Adults Committee and also leaping straight into the Vice Chair role. Very warm welcome, David. It's nice to have you here. And I'd also just like to take the opportunity to thank the outgoing Vice Chair, Mark Howell, for all his effort and time and support to me as he's served as Vice Chair. Pleased to see that you're staying a member of the committee, Mark. Really pleased to still have you here. And just as a little second announcement, I just wanted to notify members of the committee that the council received a very positive email recently from the Care Quality Commission about the council's support to care homes during the COVID-19 pandemic. And I really just wanted to recognise the hard work of our officers, so I felt it would be appropriate to read it to you. Sorry, I can hear someone talking in the background. Is that Will? Can you? Thank you, Will. You've muted yourself. So yeah, I just wanted to read you the email that we'd received from an officer at the CQC, the Care Quality Commission. And it reads, "Dear Lisa, I hope that you're well. I wanted to share with you some feedback that inspectors have been receiving during their calls. A number of managers and providers have told the inspectors about the great support that you and your team are providing to them during this pandemic. I received an email from an inspector yesterday after they'd spoken with the manager, and the manager during the conversation with the inspector said that the daily calls, bulletins and information they were getting from Cambridgeshire County Council gave them absolutely invaluable support. I think it was very kind of the CQC inspector to share that information with us, and thank you to our officers, because I think their support to our all our care providers, care homes and home care and others has been excellent. So I know all members of the committee share that thanks. Okay, so we'll move on to item 2, which is apologies for absence and declarations of interest. And so I'm proposing to begin by calling names of all the members of the committee to establish your presence. So get ready to unmute and tell me that you're here. So we haven't actually received any apologies, so I don't know if Councillor Giles has made it with us yet. We'll find out. So Councillor David Ambrose-Smith.
Here.
Councillor Adela Costello.
Here.
Councillor Sandra Crawford.
Yes.
Councillor Derek Giles, have you made it onto the meeting? Not yet. Hope to see you later. Councillor Mark Goldsack.
Present.
Councillor Nicola Harrison.
Yeah.
Councillor Mark Howell.
Yes.
Councillor David Wells.
Present.
Councillor Graham Wilson.
Present.
And myself, Councillor Anna Bailey. Does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interests today? Items on the agenda. If you do so, please raise your blue hand. No? Okay, thank you very much. So we move on to item 3, which is minutes of the meeting on the 12th of May, which we're being asked to approve as a correct record. Does anybody have any issues of accuracy relating to the minutes? If you can raise your hand now to let me know. I can't see any objections to approval of the minutes as a correct record, so we will take that as carried, and I will be signing the minutes when we are next able to get back to physical working in the office. Okay, just moving on to the action log, which I can see all actions have been completed. Has anybody got any questions or comments on the action log? If you have, please raise your blue hand. No, everybody happy with the action log? Okay, thank you very much. So we'll move on to item 5, which is petitions and public questions, but we've actually received no petitions or public questions today, so we'll move rapidly on to key decisions. So the first item is item 6, which is an update on the 10% resilience payment to social care providers, which was agreed, you'll remember, as reported at our last committee, to the end of June, and we wanted an update on the position going forward. This has been a fast-moving situation, so we've asked Will to provide the update to us verbally. So Will, when you're ready, if you could unmute yourself and give us your update.
Yeah, thank you, Anna. Can you hear me okay?
We can.
Yeah. So yes, thank you. I wanted to give an update on the support being given to providers. I think it's fair to say that it continues to be very challenging times for all of our providers. Just to recap, our COVID plan really consisted of 3 things. The first thing was to build and maintain capacity and flow in the acute hospitals, to build residential based capacity and defend our home care capacity. And then thirdly was around supporting market sustainability over the COVID period. We've been working with our providers since the outbreak, and as part of that work, we've put in all sorts of support, including things like we've booked additional beds to the end of September. We have regular forums and newsletters. We've provided PPE where there's been a risk of providers running out. And as we know, we temporarily increase fees for our providers by 10%, which runs to the end of June. It remains fast-moving and very challenging environment for our providers. And our providers have, through their care associations, now successfully negotiated new money direct from the government to support them. It's a fantastic achievement. They've negotiated a £6 million fund for Cambridgeshire, and it's focused on continuing to support homes with infection control measures. The fund comes with some guidelines. It has to be spent by the end of September of this year, and the local authority have been asked to administer the fund. 75% of the 6 million is to be paid directly to residential based providers, and the local authority has been given discretion on the remaining 25%. After discussions with the market, with our providers, we've agreed to use that discretion and pass the full 25% element through to our home care based services. There are still significant challenges ahead, including the potential for a second wave, including the NHS building back up their business as usual, and then, of course, coming into winter. And so, as Anna says, this is very fast moving, and we'll continue to work closely with our providers and support them where we can. So if I perhaps stop there, Anna.
Much, Will. So members, you've heard the update. So the the money has been forthcoming from government and is essentially being passported straight out to providers, with the discretionary element being retained by the council for non-home care home providers. So does anybody have any questions? Or Councillor Wilson, you're first.
Thanks, Will. That's excellent news. So just to confirm, we don't need to continue the 10% uplift beyond the end of June. That's what you're saying, isn't it?
Yes, that's right. So we had originally it was emergency funding that we'd put in to run from April to the end of June. Sort of running concurrently to that, the providers and care associations have been talking and negotiating with government, and as a result of that, been awarded £6 million. It's awarded directly, but through us to administer. I think I'd also say that the other areas. So for example, there are other areas that we have support that we've put in. So things like the block beds, which will continue to run to the end of September.
Councillor Wilson alludes to it's excellent news, because obviously the 10% resilience payment that we had already committed to the end of June was putting significant additional pressure on the County Council's budget. So this is very good. Nicola, Councillor Harrison, can you unmute yourself? I've got your blue hand up.
Thank you. Yes, thank you. Yes, so sorry, just to be absolutely clear, that 10% uplift, there is no question of that being continued. I mean, it doesn't matter about, whether if numbers went back up again and pressures started and so on, but the government has given no indication that there will be any more funding for that, because that has been funded by government, hasn't it?
Well, Will might want to provide additional answer to this, but the first 10% resilience payment that the County Council decided to make off its own back, which is the one that runs out at the end of June, arguably is coming out of the 3.2 billion that was awarded nationally to local government. But as we know, in Cambridgeshire, that certainly isn't covering all of our costs. And so the 10% resilience payments is certainly putting additional pressure on our budgets, and GPC committee had an update on that recently. So it's arguable about which funding has gone where.
No, I don't want to get into that. It's just that I thought that that it was a sort of requirement that government had laid down. Am I not right?
No. It was the result of a lot of lobbying. The new money, the 600 million. That was announced under it for infection control, and it also caters for additional staffing costs, is this money that Will is just talking about now. And this is a requirement that 75% of it goes straight through to the care home market. Yes.
No, I fully understand that. And I just wanted to ask a question about that, but I just, So I mean, but the headline is there is no question of that 10% uplift continuing, and therefore care homes, are having to prepare for the moment in which they've got this new grant, and that's fantastic, but they've got to get back.
That's got to be spent by the end of September. That's correct. Yeah, that's the situation at the moment. But it is a ever-changing environment at the moment.
Could I just ask about the new money because there's an overlap here, isn't there, with this report and the general COVID update report that we've got, and where obviously we're also reading about this this £600 million grant system, and sort of there's a lot in the COVID report generally, and I think it's really, really good about the sort of long-term knock-on benefits and learnings and so on that can be had, through all the work that's being done. I'm terribly sorry, Mark.
Of course, we'll be coming on to that item.
And I'll turn it off. But I just wanted to know whether or not there is any element of this grant that has to be spent by the end of September. Is there any element of that can be used for long-term benefit? Just thinking, Chair, how useful it is if all effort and all money, as far as possible, goes towards delivering something in the longer term as well as the short term. I just wondered.
Let's have very specific. Do you want to come in on that for proper technical?
Yeah, and apologies, my network failed earlier, so I've had to log back in, so I've missed a bit of this. Very untimely.
Okay.
Anyway,
Councillor Harrison was just asking. I'm getting messages saying my internet connection's unstable, so I hope you can hear me. Councillor Harrison was just asking whether there's any element of the new funding that we're just talking about that can be used for the benefit of the longer term, and I was explaining that I think it's got very specific guidance attached to it around infection control.
yes, so there's sort of two parts to that. It does come with guidelines, and they're very specific guidelines, and if the guidelines aren't met, there is a potential to claw that funding back from providers if it's not used correctly. And the guidelines do focus homes on on infection control in terms of managing and preventing infection in the homes, which we've learned certainly in the first phase, when infection gets into home, what that can do to a home, both to staff, to morale, and financially. So I think it's very welcomed in that respect. And just in terms of, I think, in terms of the previous question around the 10%, just to put the infection control money into perspective, the 10% emergency uplift amounted to just over £3 million, whereas the infection control money is 6, which needs to be spent by September, just to put the level of grant in perspective.
Thank you, Will, that's really helpful. Okay, I can't see any other indications of people wishing to speak, so thank you very much for that verbal update, Will, and for all of the commissioning teams. Very big efforts that are going in at the moment. I know everybody's working incredibly hard and keeping in touch with all of our providers, so thank you. Okay, so we're moving on to item 7, which is the update report. As you know, this item has been brought on as a late item, and the reason for lateness is obviously to allow the report to contain the most up-to-date information possible, and the reason for the urgency is obviously to enable the committee to be briefed on the current situation and ask questions around the council's response to COVID-19. Charlotte Black, I think you're going to introduce the report, please, when you're ready.
Yeah, certainly. Thank you, Chair. So I'm not going to go through the report in detail, and Will's covered quite a bit of it already in his previous item. The report does give an update in terms of the current data around both infection rates in care homes, and also we've also added some data about the number of homes that have reported a suspected or confirmed outbreak, which is actually higher than the national figure, whereas actually the sort of infection and death rate is lower than the national figure. So just to confirm to members that that's something that we're trying to understand at the moment. We've sought advice from Public Health England about whether that's a reflection possibly of, we've been very quick to link up with Public Health England whenever there has been even one possible infection in a care home. So I'm sure people will be interested in that. But we're certainly trying to get a sort of an official explanation of why that might be, whether our reporting is in some way different from other systems. So the paper really goes into, you've covered quite a lot of it. So we've talked about the care home support plan, and you've got the main contents of that plan and a link to it in the paper. That's been a large part of our focus recently, working with particularly NHS colleagues to make sure that we're doing everything we possibly can to support care homes at the moment. I think the positive thing is that they were all things that we were doing already. So developing the plan actually has been a good process because it's enabled us to formalise everything that we're already doing. And so the paper goes into detail around the Infection Control Fund. And then there are a few other areas just to draw your attention to, which I know as a committee you'll be very interested in. So in terms of PPE, we continue to have a good supply for our own staff, and we continue to have a really robust arrangement in place for any of our providers who are having difficulties with PPE access, which is to go to the local resilience forum. We also have now, through the care home support plan, a tracker that each care home has to fill in, where they indicate whether they're confident about their PPE supplies. So that enables us to go back on a one-to-one basis and find out what additional support is needed. We spent a lot of time, 2.6, there's a diagram which has actually been produced by the CCG. So we've spent a lot of time in recent weeks making sure that we've got a really clear support arrangement in place for each care home. So each care home will have a named clinical lead and a multidisciplinary team around it and a weekly check-in meeting. Now all those arrangements have just been confirmed in the last couple of weeks, so we're going to be watching that very carefully. But I think what it means for the care homes, and we will be asking for their feedback on this, is that they've got a very clear person to go to, and we think that will really help in terms of infection control, but also just managing the challenges that they've been facing really with more NHS support. And our NHS colleagues have been very keen to be part of that. So we'll keep the committee informed about how that develops. Hospital discharge, the work continues. Obviously, we are still working within the guidance that was issued on the 19th of March, which was basically said that detox counting stops and that we do everything we can to ensure that our hospitals don't have people in there any longer than is needed. And we continue to work on that. And as Will's already recognised, you know, there are aspects of the NHS which, as we would want, are going back to business as usual. We're currently in a situation where I think we are managing demand reasonably well across the system. But we are very aware that we'll be coming up to fairly soon the period of time where obviously seasonal pressures start to impact on our hospitals. So we are talking all the time with all our hospitals about what can we do to make sure that we've got the right people in the right place and that they're being cared for as safely as possible. And in the meantime, we're also doing everything we can to reduce the spread of infection. And certainly Wendy, Will and I on a weekly basis have a phone call and a meeting with senior NHS colleagues about what we call the out of hospital pathway. So what are we doing to make sure that things are going well in the community as well as things are going well in the hospital? But it will be a big challenge coming up, and we do have some of our care homes who don't feel at the moment that they can necessarily accept someone who, you know, it is their home. But actually, we are in the process of sorting out exactly on a case-by-case basis, really, what steps do we need to take to make sure that if someone is going back to their care home, that that's done in a safe way, and that they can be isolated basically for 14 days, which is the main criteria. But I think we've got a really good collaborative arrangement going on with our hospitals at the moment. The paper goes into detail around the impact on the workforce, which is always obviously an ongoing challenge and issue. But the other thing that we've done is we have also put in place some training for our staff who are working with quite a lot of people who have been bereaved. So that's been a really good development. So some training from crews so that when our frontline staff and duty teams and others are talking to families who've been bereaved, they feel they just make sure they've got the skills and support that they need to do that as well as possible. And we've done some really excellent work. I think I want to draw your attention to what we've done around carers, which is in section 2.10. That's been a large focus of our work and really supported by the county and district hubs. So we've had really good feedback from our carers that they're really impressed that we've gone to kind of quite a lot of lengths to reach out to them and to find out what they need. And in many cases, they say, actually, I don't need anything. It's just really good to know that you're there and that if I do need something or need some help, I know who to go to. So that's been really positive. And I think, you know, we've got so much to thank our carers for at the moment, especially our unpaid family carers who are basically managing incredibly well, but obviously starting to feel the strain as well. And then I'd also just want to draw your attention to the work of the Learning Disability Partnership. One of my biggest concerns at the start of this process was the vulnerability associated with people with a learning disability and the risk if they were admitted to hospital, and the hospital was very keen to discharge people, the risks around making sure that they do go to the right place and return home wherever possible. And I mean, the data's, I won't go through the numbers, but I think our Learning Disability Partnership in Cambridgeshire, and that's health and social care staff, has done an outstanding job. They have done a really good job in terms of preventing admissions to hospital, but they've also worked really closely with the learning disability nurses in the hospitals to make sure that when someone is ready to go home, they get them back to the right place. And they've worked incredibly flexibly, including, as the report says, that some of our staff who would have been running day services have been providing direct care into people's homes, and also we've had some really good redeployed staff as well who've got involved in reablement and other services. So I'm really think we should be really, really proud of the work that the LDP has done. I won't go through any more in detail. There's a section on the fact that we're slowly implementing the contributions policy. We have now recruited 3 new staff for financial assessment work and 3 new staff. We're still looking for 3 more. And we've got a new manager who I think will be excellent, who will be managing the financial assessment team and moving over to operations in the next few months. And then Adults Positive Challenge carries on, really. We're doing everything we can to kind of keep true to the spirit of Adults Positive Challenge. And actually much of the work that we've done has been really, our response to COVID, I think, has been really informed by the principles of Adults Positive Challenge. And I think Adults Positive Challenge will really inform what we do as we sort of come out of COVID. Although it's fair to say we're not expecting a massive change, we think that this is going to be an ongoing process, an ongoing challenge that we're going to be dealing with. But we have to keep thinking about what do we do to maintain people's independence and outcomes. And I think that's probably the main thing. So there's a brief section here on recovery, but we're sort of in a twin track process at the moment. We're thinking about recovery as well as response at the same time. But I think a lot of the principles and approaches of neighbourhood cares have been very, very evident that that's very much in the bloodstream of the health and social care system now. So a lot of the work that's been going on in the community hubs, a lot of the work that we're doing and the conversations we're having with the NHS about sort of place-based solutions, I think are evident. There's evidence that the sort of neighbourhood cares approach is absolutely embedded really in terms of how we respond to needs in the community. I don't know, Will, is there anything else that you think you need to add that you haven't covered already?
No, thank you, Charlotte. I think I covered off the main commissioning points earlier, I think, but I'm happy to take questions.
Thank you very much, both of you, and thank you for an incredibly comprehensive report when you've got so many other competing demands on your time. It really is a detailed report, and thank you. I've got Councillor Sandra Crawford.
I wondered if there was any cause for concern on the workforce update on page 11, where you have employees and carers self-isolating, alongside the recommendation that staff should have fewer people to look after for the purposes of not spreading the infection. I know you've still got 3 vacancies and 12 applicants have accepted offers, it says at the bottom of the page. But do you think there might be any cause for concern for staffing, especially with the potential for a second wave? That's it, really.
Okay, so we're trying to sort of do 2 things, really. One is to make sure that where staff do need to self-isolate, they do. But make sure that if we can get people back into work safely, we also do that. So we're obviously trying to maximise the existing workforce that we've got. And we've had really good support from our HR team and our occupational health team, who will sit down with a member of staff, obviously not literally, but virtually, and work through what are the reasons. Is this in terms of the government guidance that we've got, which obviously changes all the time? either how can they continue to do some work remotely at home, or if they have very frontline roles, you know, in what conditions would it be safe for them to return to work? So that's an ongoing process. But actually, I think a real positive has actually been that we have had a lot of interest in our jobs. So we're now at a point where we think we could potentially recruit to whatever, not within reason, if we were to look at our enablement service and think about the demand that we know is going to be coming up, to think, well, we could actually sort of take a risk and maybe look at whether we could recruit more enablement posts than we actually have, because we recognise that actually that will be a really good way of resolving some of the kind of unknowns ahead in terms of, you know, difficulties that care providers might have, or other things that might impact on sort of staff availability, because our enablement staff are very flexible. So we are thinking at the moment about, given that we're getting lots of interest in our roles, you know, how can we make the most of that as an opportunity? So I think that for both, this applies to both councils actually, as then both councils getting a lot of interest in our jobs, which is a really good position to be in. Some of that's because we've sorted out our processes, but some of it is actually that people are interested in these jobs, whether that's to do with the care market or the profile of care jobs, I think has been raised in many ways, which is a really good thing.
Really good to hear. Thank you, Charlotte. Good questions. Councillor Graham Wilson.
Thanks, Anna. I think this is an extremely comprehensive report. Thank you, Charlotte. I've got a few comments and just questions really, and a couple of observations. The care home support plan I found extremely helpful when I looked at that on the web. It's an extremely comprehensive description of all the good work that is being done with care homes that I think a number of people not on this committee should be aware of. And equally, the work that we're doing to support carers is really good. What I'm slightly unclear about is what the financial impacts and service impacts are of all this additional work that we're having to put in. So we've got the financial statement, but it doesn't yet tell us whether we're going to be able to recover any of the additional costs from NHS or government, or whether it's going to have to come from county council reserves. And then the other question, are we able yet to assess what the impact might be on our day-to-day services that have had to either be slowed or stopped? Because you referred to the financial review, and it's that getting going now, but there were assumptions being made about savings to be achieved, and clearly some of those savings we're not going to be able to achieve, and they're reflected in the financial item. But I just wondered if you can say anything more yet about impacts on other services.
I think Wendy's going to answer the finance question.
Anne, are you happy for me to answer the finance question?
Yeah, I mean, obviously we had some quite detailed information to General Purposes Committee about the overall position, didn't we, which is largely made up of Adult Social Care Directorate. But yeah, Wendy, please.
Yeah, just to say that you know, we have been very focused on the finances in terms of the here and now and later on, and we have made sure that we have developed very robust business cases, not only on what we're needing to spend in the here and now, but what we think we're going to need to spend in terms of as we come out and through the pandemic. And those business cases have been submitted with the MHCLG returns that we have to due on Wednesday, I think. So we are making sure that government is clear about what we not only have spent, but what we think we're going to need to spend. And that should influence them in terms of what's required by all authorities as we move forward.
So is there anticipation, sorry Anna, is there an anticipation that this 15.3 million we will be able to get back from government in one form or another?
That's just before I bring Wendy in on that, there certainly hasn't been anything concrete coming forward, Councillor Wilson, yet, but I've been attending the MHCLG calls, and certainly on the most recent one, I think there is an absolute understanding of the finances and still calling for evidence. and government is certainly listening. I think there is an understanding of the state of the finances of particularly upper tier authorities. Wendy, I don't know if you wanted to add anything.
No, exactly what I would have said, Anna. Thank you.
In terms of Councillor Wilson, of your second question about the impact on day-to-day services, I mean, the report does outline actually that some of our services have actually, demand has gone down, which isn't necessarily surprising because so many people have been in, obviously, well, everyone's been in lockdown. So I think we are still at a point where we really don't know what demand will look like as we move forward. I think we've had some opportunities to try doing some things quite differently. And so day services, for example, we've been doing an awful lot on a one-to-one basis and virtually. That doesn't mean that's the only way to do work, but actually we have learned things about how we could deliver our services differently in future. And we've had some really interesting feedback from the people we support about their experience of that. And it is something I think we need to do more of in terms of getting some more detailed feedback. But yes, inevitably, there are some things like our financial assessment processes where, you know, the pace at which we thought we would be able to make some of those changes, we've had to revise. But there really isn't anything that's stopped. It's more that we've had to adapt, and that as we go forward, we're going to have to really think about, well, that adaptation that we made, actually, is that something we want to continue with, or is that something that we think hasn't really worked? So we have learned quite a lot. So an example of that is that we, you know, we have a statutory obligation requirement to do an annual review of someone's care package and their care and support plan. We've always instinctively felt that that's something that should be done face to face and not been too comfortable with doing that remotely without going into someone's home. But actually what we're starting to do now is to develop ways of doing that actually are quite positive, because it means, for example, that the family member, maybe someone who, you know, someone's time for someone's annual review, but their main, you know, family member or a daughter or a son possibly lives quite a long way away, wants to be involved, but can't be there, especially for that review. But actually now they can be involved, and we can do quite a lot of work before and quite a lot of work afterwards. So it's challenged some of our assumptions about how we think we should do things. That doesn't mean that we would make massive changes without quite a lot of consultation and sort of co-production, but it's really been interesting in terms of, you know, our adult early help team, we thought had to be in one building, all in a small area, sort of talking to each other about the cases that they were trying to manage, but actually they've done a really good job all working in separate buildings. So it's really challenged us, but I think we're very aware that we've got a lot of unknowns ahead of us in terms of people who might be eligible for social care who weren't previously, for example.
Yes, okay, that's helpful. I'm just conscious that there are people from other directorates, like the highways people, who've gone to support the hub, and they must have been doing things before that were useful, and they're not now, they're doing different useful things. So I'm always keen to know what the implications have been as to just how important were some of this work previously, and again, should they be doing it in a different way when they go back? Okay, thank you.
Really good questions, and in many ways it's accelerated some of the work that we were already on track to be doing around think communities and the tech work stream of the Adults Positive Challenge and putting tech into people's homes. So and obviously day services have been stood down during the pandemic, haven't they? And the staff have been working in other areas. So at some point we'll need to think about how and when they can be safely reinstated. But really, I mean, it's just been incredibly impressive as to how the show has been kept on the road. I think one of the things that's kind of exercising me is, you know, there is a lot of potentially new dependency that's been built up during this crisis, because people have had to be at home and they've had to be in complete strict lockdown, particularly those in the shielded category, you know, and they've stopped driving and they've stopped going out, and you know, things can deteriorate quite quickly. So I think yeah, there is a big concern about trying to keep the volunteer effort going, and you know, how it's an unknown as just to how much longer term demand there may be in the system, really. And I think that is something that, you know, is worrying, and we need to keep thinking about and working towards. I've got Councillor Goldsack next.
Thanks, Anna. couple of really interesting points that came out of there that jumped out to me, Charlotte in particular. One was I was really impressed by the fact that some of the frontline staff have been trained by a charity to have some skills in grief management and being able to speak to their people very better. This may be a leap too far, but as somebody who's involved still at the coalface end of the volunteer side of things, if we could get any of that kind of, it doesn't need to be to a great level, but if we can get any kind of support to recognize these kind of things out to the volunteers who, I mean, for instance, in our little community, we've got people who are making just weekly phone calls out to people just to say, hi, how you doing? And actually being able to pick up that knowledge, it would be, and if you think about it, it would be a great burden off the council as well. If people could do that and then know where to take that information. So I don't know whether it's possible to have a word with the charity that were involved, just to say if they could run an open seminar one day and we could get people to come onto it and offer that around. I think that would be a really valuable exercise. So yeah. That one, sorry, and just the second point, I think I've got it right, but I need to understand it. On page 11 of the COVID testing thing, it basically was alluding that 25% of those tested were positive. I'm assuming those tested were those that thought they had symptoms in the first place. Is that correct?
Yes.
Oh, yeah.
Yes.
Thank goodness. Thank you.
And actually, yes, that was in terms of they were sent for testing because they fitted the criteria in terms of thinking that they had symptoms. The bereavement training, Councillor Goldsack, definitely, I will follow that up with public health because it's public health who've actually led on that work. And I think it's fairly easy to open it up. I think obviously there's a bit of a cost implication, but it's not significant. And I just think it's such a priority at the moment. So I'll propose to them that they could open that up to sort of key voluntary groups.
Well, I think it would be about the other thing is that I love the fact that you were learning from the exercise that we have been forced to go through and have taken those learnings forward. Similarly, again, at a local level, I know in other villages and communities as well, this neighbourly warmth and neighbourly attitude to people, I don't think that's going to switch off as soon as lockdown is finished. And I think we've got to make the most of that. So actually, the more skills and knowledge we can put into those situations, from that as an example, I think the better everybody's going to feel and be. But thank you. If you could do that, I'd be very pleased.
I certainly will.
Very much, Mark. That's great. I remember sitting in a room with Charlotte talking about a fledgling neighbourhood cares pilot project and saying, wouldn't it be amazing if we could get this down to street level? And that's exactly what's happened. It's been incredible. Yeah. Councillor Costello, Adela.
Yeah, hi. It's just a question, really. Perhaps Charlotte can answer. Adults with learning disabilities have been locked down now for a few months. No daycare services. I just wondered if their carers have the opportunity for respite care, and especially in an emergency situation.
I would need to double check that, but I know that the learning disability staff have contacted every single carer that is on our books in terms of learning disability services and asked them what help they need and what support they need. I think the majority have been, as I understand it, the feedback I've had, they've been really keen to make sure that their cared for person is as protected as possible. But if we have come across a situation where a carer is really struggling, then we will find some sort of solution. And sometimes that might not be respite care. It might be sending someone from the day services into the home and enabling the carer to leave the house. But unfortunately, there hasn't been anywhere to go either. So I think we're very aware of that group. And I think what's really nice is that we know the cohort, we know the population so well that actually they've got really well established relationships with people in the LDP who know them very well and know their circumstances very well, which means that it's possible to have that conversation in quite an honest way. So I will double check there and I'll get back to you on the specific query about whether any respite care has been made available. But the fact that we've had such a good outcomes for people in terms of avoiding admission from hospital makes me think that we've been getting that reasonably right. But we're always very open to feedback about what we could do differently.
Okay, thank you.
Thank you. Councillor Harrison, Nicola.
Thanks, Chair. I just wonder whether we could just think a minute about what is worrying you, because obviously an awful lot of good work's going on, really impressive. There's genuine innovation going on, and you say that in a way a lot of it you're doing anyway, which of course is marvellous in a way, but of course there is a possibility therefore that it's not innovative enough, because this is a crisis and a unique situation, and in a way there is a possibility, isn't there, that it should throw up innovation that nobody has thought of before and couldn't possibly have done. So it'd be interesting to know whether you feel that there is that direction of travel as well into really new ground, and whether in fact in a way there's a resistance, whether there are obstacles to that true innovation. So sort of I'm trying to get you to just focus for a minute on what's worrying you, because I'd like to have a little list of that in my mind, because I know that it can't all be fantastic. I'm thinking that probably PPE is one of them, because I think I'm thinking that probably the approach of winter is another, but I'm not, and I'm wondering whether, resistance to innovation, if you like, or, just that becomes a point where innovation becomes really hard to deliver, whether that's another, and whether there are others. It would just, I think it would be right for me to have it in my mind, I think, a list of the problems that you're facing.
Will may want to answer about this from a commissioning perspective. I think from my perspective, I think in terms of PPE, we are in as good a place as we have been, but it's obviously something to worry about because we can never take it for granted. And I don't have any sense of resistance to innovation. Sometimes we might meet some technical barriers about things that we want to do, but we're generally overcoming those. And I find the staff group I'm responsible for is really, really keen to innovate, actually. They've sort of got the bit between their teeth on innovation, I would say now. They know that there's lots of willingness and permission for that. I think my biggest concern probably is the winter. So we know that we will reach, at the moment, as I say, the hospitals, I think, are generally being very understanding and accommodating, and if we think that we can have a good sensible discussion about what is the best discharge arrangement for someone and where should they go and when. I think what's likely to happen is as services around adult social care go back to business as usual, I think that is going to increase the pressure on us, which is why it's really important that we make sure our staffing capacity is as good as possible, that we get people back to work when we safely can, and that we make the most of the opportunities to recruit, because that gives us some resilience. And we know that our arraignment service is incredibly flexible and can do all sorts of things very well. So I think at relatively low cost. So I think probably that is my biggest concern. Wendy and Will may want to add from their perspectives. I suspect we've all got slightly different worry list at the moment.
So
is there anything?
Sorry, Anna.
I was just bringing Will in, but you go first, Wendy. It's absolutely fine.
Thank you. I think the thing that plays on my mind, that might be because of my role with the county hubs and that, is that, exactly as Councillor Goldsack said about how the community has really come together, and we absolutely have to now, not wait, talk to our communities about what they will do in the long term. We shouldn't wait till we've come through the pandemic to really galvanise that in terms of our Think Communities approach and the work we've done with our libraries, what the staff have done differently. So for me, what's in my mind is we have to find the capacity to start building what will come afterwards rather than just deal with the here and now. And that has to stay at the forefront of our minds. And I'll leave Will to talk about his worries around commissioning.
I'm sure we saved the best till last. Off you go.
Thanks, Anna. So I'd say two things actually. For our providers, this has turned into an absolute marathon for them and for their staff. They really have ended up fronting the brunt of this actually, and it feels like we're in a period of not pause but reasonable quiet. And I suppose what's in the back of our mind is, as Charlotte said, winter is coming. The NHS is very keen to return, and rightly so, to business as usual. And then things like a potential wave 2 COVID wave 2. And so what's very much in the back of our minds and what we're talking to providers about is how we support them financially and non-financially, from September onwards, and keep them going and sustainable. I would say and I'll give an example. One of our providers has sort of come to us with their learnings around COVID and the ways in which they believe they need to change their working practices going forward. And it's really interesting because they're talking about place-based. It plays right into the Adults Positive Challenge work, right into the Think Communities work, which for us is really, really refreshing. So we've got a market that is doing a fantastic job. It's still got loads and loads of challenges ahead, but is actually also learning and wanting to change positively towards place-based type services going forward as well.
I think we've lost him.
Well, we seem to have lost just that last sentence. You seem to get muted.
Hear me now?
Yeah, that's better.
Yeah. So I suppose in summary, there's still big challenges for the provider market going forward around, funding and coping with winter pressures, business as usual, and wave 2s and all the rest of it. But interestingly, they also have been learning through this process, and they're coming forward with some very creative ideas about how we might want to commission services differently. And there's huge alignment to the Think Communities work and the place-based commission work and the Adults Positive Challenge programme, which for us is brilliant.
Great, that's really helpful. Thanks.
Okay, can I check whether anybody else wants to speak or ask any questions before we move on? I'm not seeing any further indications of people wanting to speak. So back to the recommendation, we're just asked to note and comment on the progress made to date in responding to the impact of COVID-19. So thank you very much for the update, and we've noted that. Okay, so on to item 8, which is the committee's agenda plan and training plan. And we're also, because we're into the new calendar year, the new civic year, we're being invited to make appointments to the outside bodies. Have there been any changes to the agenda plan, Tamar, since publication?
No.
Okay, lovely. So.
Sorry,
not that I know of.
Charlotte.
Yeah, I just need to just make you aware. I haven't got the right bit of paper in front of me, but I saw that we had on the next agenda the care home support plan, and obviously you've received a copy of that today. So I think what we would be bringing to the next meeting is the action plan.
Yeah, okay, that makes total sense. So if we can make sure that that gets reflected in the forward agenda, that would be really helpful. Anybody else have anything to raise on the forward agenda plan? No, okay. So we'll take that as noted. And we're being asked to, what are we doing next? The training plan, anything on the training plan? I mean, obviously that's taken a slight back seat, but I know lots of our members have been on lots of the brilliant training. Okay, and in terms of the outside bodies, that's set out in Appendix 3 of the report, and there are some changes highlighted there. Do members have any questions or comments on the appointments? We're happy to move to the vote. Can I ask if anybody has any objections to the outside bodies appointments? If you do, if you could raise your hand now so that you can speak on it. I'm not seeing anybody indicating, so I'll take that as a general consensus in support of the recommendations. So we'll take that as carried. Thank you very much. We now need to move on to item 9, which is so that we can hear item 10 of our agenda, we need to exclude press and the public because the final item 10 is a request to commission additional block contract residential nursing and planned respite care, and it's exempt from publication. So the committee needs to decide whether to exclude the press and public from consideration, and we will need to move our meeting to Microsoft Teams, which you've received the invitation for, and it's considered that, you know, this item is not in the public interest for it to be held in public. So may I ask if there is a general consensus in support of the recommendation to exclude the press and public from the next item? If anybody has a problem, if they could raise their blue hand, seeing lots of happy looking people, so we'll take that as carried. And so if I can, the public part of this meeting is now going to be closed, but if I can ask all members and relevant officers to go straight onto the Microsoft Teams meeting, please, straight away, where we will reconvene. Thank you very much, everybody, for, and we close the public part of the meeting. Thank you.